Good evening, ladies and gentlemen. On behalf of team DentistChannel.Online, I extend a very warm welcome to each and every one of you attending this live webinar on the topic Anti-Retraction Dental Handpiece, an ideal choice during and post-COVID-19 pandemic. A very important webinar would be taking place shortly. To this, we have an esteemed speaker from the dental fraternity. His name is Mr. Sharat Shetty. Mr. Sharat Shetty has been associated with NSK since 2006. His key role is handling the after sales and to provide technical support of NSK products to the distributors as well as the end users. Under his leadership are countries that come under the Middle East, the Africa, as well as India. He has been regularly conducting product cum technical training for distributors and has also been conducting maintenance training for assistants, technical in charges, and doctors. He is the key person when it comes to the dental events that come under his region. Mr. Sharath, we're really happy to have you on board, and I now request you to kindly continue with the dental webinar. Thank you.
Thanks, Ruben.
Sir, please enable your camera.
Kindly enable your camera, sir. Thank you.
Yeah, enable. I've enabled it.
Yes.
Okay. Thanks, Ruben, and good evening to all the attendants here. So it's an honor for me to be here on behalf of Dentist Channel. Thanks for arranging this. Good evening to all the dentists and the people related to dental fraternity. Okay, as Mr. Ruben informed you all, this would be a session wherein I will be explaining you briefly, or I'll be explaining you about the importance of using the right handpiece, especially during as well as after this COVID-19 period, which all of us are going through. Unfortunately, the current wave is been increasing day by day. So all of us, we are praying together so that this particular thing comes to an end at the earliest possible. So until then, we have to keep waiting and hope for the best. So when it comes to dentistry, there are lots of equipments and there are lots of day-to-day instruments which we people use, which needs to be taken care of and also which needs to be handled as well as used as per the proper requirements. Now coming to the handpieces, on which my main subject is for the today's presentation, there are certain handpieces which has to have additional protection, without which there would be a possibility of contamination or spreading of bacteria, virus, and all this stuff. So I would like to start my presentation explaining you few key factors regarding this criteria, and also since as introduced by Ruben, as I am working for a company called NSK, we have a range of products which can help you to select the right handpiece for especially at this time so as to get you the maximum protection. Okay, so I start my presentation now. So when it comes to oh. Okay. I would like to start my presentation by explaining about the concept of anti-retraction valve and the clean head system. I don't know how many of you all are aware of these things. I understand most of you all must be knowing about these things. So before that, let me just introduce you to the range of NSK turbine handpieces which you are currently having in the market. All these
PPT is not shared. Please check it.
Now
It says started screen sharing is waiting. Or you can reopen it.
Again, one second, I'll just
Screen.
How about now?
Yes, sir. Please go ahead. Make it preview, full screen view.
Yeah.
Yeah. Perfect.
Okay. So what you see on the screen is the complete range of NSK air turbine handpieces, which are currently available with NSK for the Indian market. So we have a couple of new handpieces which are also launched. So as you can see, we have a range of handpieces with NSK, the premium range, the coupling range, and direct type. So I understand most of you all are aware of what is coupling type and the direct type. The coupling type is a handpiece which has an additional coupling which enables you the optic source, the light. The handpieces which work with light are the ones which comes with the coupling type. And the handpieces which are of direct type, these are the ones which are connected directly to the tubing. But most of us are not aware that this coupling type has an additional advantage in addition to the optic source. Now, what are those additional advantages? Now, when it comes to advantages, the coupling type of handpieces has something called as anti-retraction valve, which we call it as non-retraction valve, in other words. Now, what does this non-retraction valve do? As you can see in the screen, this non-retraction valve is available for optic type of handpieces as well as non-optic type of handpieces. Okay. So what does this non-retraction valve do? So let us understand what is the purpose of this. So in NSK, we have two types of protection in each and every dental handpiece which we have. And those are clean head system and a non-retraction valve. Let me explain you about the clean head system. Clean head system is a system wherein during the operation, when you people work on the patient's mouth, as soon as you release the foot control, there will be a small amount of negative pressure, which takes place for a period of hardly like 2 seconds or 3 seconds. After every time, whenever you release the foot control, there will be a reverse flow. This reverse flow could be of the patient's the blood, it could be the saliva, it could be the what we call the debris, whatever is there in the patient's mouth. It tends to flow back, it tends to suck back, and where it goes directly into the handpiece. And there is a possibility that this liquid or this fluids, it goes inside the handpiece, passes through the handpieces, and then goes to the tubing. So what happens if at all you do not have time, or if you could not lubricate the handpiece before the next patient hops in? Now the same layer fluid which remains in the tubing passes through the handpiece, and then there is a possibility of that entering into the next patient's mouth. This is taken care by the clean head system from NSK, wherein we have a protective shield ahead of this head part of the handpiece. So all the reverse flow which happens, the fluid particles, it will enter back, but it will hit the shield and it will go left and right, as you can see in the picture explained in the clean head system. That is what we call it as clean head system. Now this mechanism is available with each and every handpiece of NSK. All the high-speed handpieces I'm talking about, the air rotor handpieces. Then comes the non-retraction valve. But before I go to the non-retraction valve, let me highlight to you, this clean head system is a protection which is provided in the air line of the dental handpiece. Now, what do I mean by air line? All of you all know that the dental handpiece has two passages. One for the air, the dry air. Two for the water, for the cooling of your bird. There's another line, that's a water line. The clean head system protects your handpiece from the reverse flow for the air line, but not for the water line. But for the water line, there is something called as a non-retraction valve. So when I say non-retraction valve, this non-retraction valve is implemented, or this non-retraction valve is installed in the coupling of the handpiece, not on the actual handpiece. That means whichever doctor who is not using a coupling type of handpiece, that means that particular handpiece does not have the protection for this reverse flow into the water line. So this non-retraction valve, as you can see in the picture, it's a small color, the red one which is there on the screen, but actually it's white in color. This prevents the reverse flow of water. How does this happen? Again, as you people release the foot control during an operation, this valve closes. This valve closes and it makes sure that the reverse flow of the fluids from the patient's mouth does not enter the handpiece. So water flows from one line. It goes from the tubing through the handpiece to the patient's mouth. As soon as you release the foot control, this valve closes and the water inside the handpiece remains stagnant. It will prevent the reverse flow of these fluids into the handpiece. So this is a very, very important protection which has to have in each and every dental handpiece. Only having a handpiece with clean head system is not sufficient. That means such protection is needed whenever you use a non-retraction. Such protection is possible only when you have this non-retraction valve, which is available only on the coupling type of handpieces. So this is a very, very important aspect. Only when you have both these systems fixed or installed in your handpiece, then you can be 100% sure that cross-contamination will not take place from one patient to another. Until today, we were not so much concerned about this non-retraction valve. Okay, we are buying the direct type, which is more popular in India. Just connect to the tubing, you work. Fine. You have 50% protection. That is, your air line is sure or it's protected from this reverse flow, but not the water line. So that means, especially in today's world, when we have a major threat of this COVID-19, we need to be more cautious. We need to be more, we have to take more precautions so that the reverse flow of this fluid or blood or saliva, whatever it is, it doesn't enter the waterline of the handpiece, ensuring that there is no cross-contamination from one patient to another. Okay, so this is something which you need to know about this clean head system and non-retraction valve. As I informed, all NSK handpieces comes with the clean head system inbuilt. You don't need to worry. Only the non-retraction valve, for the non-retraction valve, you need to go for the coupling type. Now, I'm sure you must be wondering, like, just for this non-retraction valve, should I buy the expensive handpiece, which is like 30 or 35,000 in Indian market, or should I go for an Optic handpiece? No, it's not like that. You have an option. Is there an option to face any threat of this, even for the direct type of handpiece? If you're using a normal handpiece, yes. From NSK, we have a very famous handpiece, especially in the Indian market, which is called as Pana Air FX, the most basic handpiece sold by NSK in India. This is sold by one of our authorized distributors in India, which is called Confident Dental Equipments. They are selling the current handpiece, the direct type, not this, not this coupling type. That is a direct type of handpiece which goes to your tubing. But now the same handpiece will be available with the coupling type. That means you just need to go for the QD type. So next time when you're purchasing a handpiece, you can insist or you can inquire if they have this QD type of handpiece. Now, what is this QD type? It's exactly the same handpiece, but with a different shape, and it comes with a coupling. That is a QD coupling. Now you clearly understand now what is the use of this coupling, because this coupling has this non-retraction valve. The clean head system is already there in the handpiece, just the non-retraction valve will be there in the coupling. So once you purchase this set, the handpiece as well as this coupling, then your handpiece gets this protection of non-retraction valve as well as clean head system. So this is something which it's already available in the market. As I told you, Confident Dental Equipments is the one who is marketing this handpiece in Indian market. Any other option? Yes, we have another hand. As a direct silicon Denmark. The previous handpiece, the Pana Air FX, is available with Confident. This handpiece is also available with the coupling type.
Excuse me, sir. Excuse me, sir.
Yes.
The sharing stop. How about come back?
Okay, so this FX Plus is a handpiece which is sold by Unicorn Denmark. The same handpiece was previously sold with the direct type. Now, again, you can inquire or insist for a QD type, wherein this handpiece will come with the additional coupling with the protection of non-retraction valve. Now, there are two additional features in addition to this non-retraction valve. What are those? One, yes, this handpiece has a non-retraction valve. Two, as the name suggests, the QD coupling is quickly detachable. QD stands for quickly detachable. You can easily remove the handpiece. You don't need to again and again loosen the threads of the handpiece every time when you want to insert the handpiece. So it's just pull out and fix in and push in is the easiest way of inserting and removing the handpiece from the coupling. And one more additional advantage of this handpiece is if you're working on the lower jaw and if you want to change over to the upper jaw, the twisting of the tubing will not take place. That means it's a twist free. You can hold the coupling and just rotate the handpiece. It's a 360-degree twist. So these are the three advantages which you get once you go for the QD type. I repeat, there are two types of handpieces available. One is the Pana Air FX, which is sold by Confident, and another one is the FX Plus, which is sold by Unicorn. Let us assume some of you all are already using some other handpieces from NSK, which is Dyna LED, the self-generating light. I'll not go in detail of that because that's not the topic now. And we have Pico also, the smallest head handpiece. Those handpieces were direct type of handpieces sold by both the companies, Confident as well as Unicorn. Now, even this QD type is available also for these handpieces. For example, that means in future, if you need to purchase any Dyna LED or Pico, you can go for this QD type for these handpieces also. Now, let me clear one doubt. Can we change the existing direct type of handpiece to a coupling type or to a QD type? The answer is no, because the connections are different. So that means in case if you have an existing handpiece without the QD option, that means if it's a direct type, no, that the QD option cannot be implemented there. You have to purchase a complete new set. That means a new handpiece as well as the coupling. Okay, so this is an option with which you can get this feature of non-retraction valve with all types of NSK handpieces. Now, there was an article released by International Journal of Oral Science. I understand most of you all must have gone through this particular article. I've just highlighted one particular sentence in that. I've just extracted this, or it's easily available in Google also. The underlined portion. Therefore, the use of dental handpieces without anti-retraction function should be prohibited during the epidemic period of COVID-19. That means the importance of having an anti-retraction system in your dental headspace is much, much more already identified even by the experts from the International Journal, the Journal of Oral Science. They have also released such statements saying that anti-retraction valve is very, very important. So in case if you do not have such facility in future, if at all you are planning for any handpiece, it's always good to insist or to stick to the handpiece with the anti-retraction facility. Okay. Now I'll just play a small video which will clearly explain about this anti-retraction valve as well as the clean head system. And also from NSK, we have, for example, assuming that maybe it may not be possible for you to change your complete setup. Okay, fine. For that reason, we recommend after every patient, you lubricate your handpiece. Okay, you lubricate the handpiece after every use in order to ensure that no fluids remains in the handpiece. And for that lubrication, we also have a specialized NSK spray, the lubricant spray from NSK, which has been explained in this video. It's just a short video. I request you to go through this. Okay, that was just a small video on this handpiece lubrication as well as the clean head system. One thing what I would like to highlight here is the special spray from NSK. It has a what to say, like the mixture of 78% alcohol. So as all of you all know, the contents of alcohol helps in in maintaining this disinfection, and also it helps to clear the bacteria, or it helps to clean your handpiece completely after whenever it is lubricated. So it's always good to go for a good quality oil spray. Okay. Then, in addition to that, we have certain other handpieces, the optic type of handpieces from NSK. So whenever I say optic type of handpieces, automatically these handpieces comes with the what is called as non-retraction valve. So I don't need to explain again, because by default all optic handpieces comes with a non-retraction valve. From NSK, we have launched a very new handpiece very recently. This was just launched in the month of December 2019. This is a new handpiece, S-Max series called M900L, which has a specialized feature of very high cutting power. We had a previous version called M600L, which had a cutting power of 20 watts, but now the new version called M900L comes with a higher cutting power of 30% more, which is of 26 watts. Again, this handpiece is available with both our distributors. Then compared to any other companies, this particular handpiece comes in a much higher range. I mean, the higher torque. This is also available in the different categories. That is, we have handpieces which can fit into NSK coupling. We have handpieces which can fit into Cavo, Sirona, W&H, and Binair coupling. That means any of you who are using Cavo type of couplings in your dental chair or Cavo handpieces, we have handpieces which can fit into such couplings. If you are using Sirona, we have handpieces which can fit into Sirona. If you're having W&H, we have W&H, and also for Binair. Okay. Then, of course, as I said, there are again the FX Plus handpiece, which I showed earlier, which is sold by Unicorn. This is also new in the market. We just launched it 3 months ago. The specialized feature of this handpiece is it has a very high cutting power of 30 watts. Okay, compared to any other basic handpieces, this handpiece has a higher cutting power. It also has the feature of pressure regulating valve. Similar to Panair FX, we have something called as pressure regulating valve. Now, what is this pressure regulating valve? There is a specialized valve inside this handpiece which prevents the damage of the cartridge from excessive air pressure. That means even if the air pressure is beyond the set limit, beyond the desired limit, this pressure regulating valve protects this handpiece from this excessive air pressure. So you don't need to worry that air pressure is high, or of course, if it's low, obviously you will not get the cutting efficiency. But if it's high, there is a possibility of the cartridge, that is the inner rotor, getting damaged. For that, this pressure regulating valve plays an important role. So we have 3 handpieces or 3 range of handpieces from NSK, which has this pressure regulating valve. One is the Timex Z series, the optic version. The second one is the Panair FX, the one which I told earlier, sold by Confident. And the third one is FX Plus, which I showed you now, sold by Unicorn. These 3 handpieces has this feature of pressure regulating valve. Okay, so that's about this handpieces. Okay, now, in addition to this, I would like to inform you one more thing, or I would like to highlight one more product which also plays an important role as a replacement for your high-speed handpieces. That is something called as electric handpiece. That is called as a handpiece which is run by micromotor, or the high speed which is run by micromotor. Now, how does this work? Most of you all must be aware of this. The NLZ-E is the new electric micromotor from NSK, which also has the facility of non-retraction valve. Similar to our high-speed handpieces or similar to our aerotor handpieces, all NSK micromotors, including this motor, has a non-retraction valve. Now, all of you all must have understood what is the purpose of the non-retraction valve. It will again prevent the reverse flow of the fluids from the patient's mouth into the handpiece. Now, where is the non-retraction valve in the motor? Any NSK motor which you see, the internal spray motor I'm talking about, it will have a blue colored O-ring. Okay, the second O-ring from the bottom that acts as a non-retraction valve. That means when you connect the handpiece to this motor, whenever you release the foot control, this O-ring expands and it stops the water flow to the handpiece. Okay, so it prevents, or it allows the water to go only in one direction, not in the opposite direction. So that means any doctor who is using an NLZ micromotor from NSK will have the feature of non-retraction valve implemented in it, as a result of which you can be rest assured that there will be no reverse flow of fluids from the patient's mouth going into the handpiece, thus protecting you from the cross contamination which could take place. So this is another feature. Now, Considering today's situation, all of you all must be knowing that aerosol generation is also making a big impact, or it's also making news that most of the dental clinics, they should have this, what to say, like the suction wherein the aerosol can be sucked and other things. So we have this micromotor, which I was talking about, the NLZ. This works with a red ring handpiece. Now, what is a red ring handpiece? It's a speed increasing handpiece. So whenever you use a speed increasing handpiece, the amount of aerosol coming out from this handpiece is comparatively lesser than the normal aerator handpiece. Let's see some examples. Okay. Just watch this video carefully. Of course, it's not so clear, but if you see carefully on the first one, we are treating with the red ring handpiece. You can see the amount of aerosol coming out. In the second one, we are treating with the aerator handpiece, and you can see the aerosol coming out. Comparatively, I'll just say comparatively, it's lesser than the aerator handpiece. That means the one with the red ring, the aerosol generation is comparatively less as compared to the one with the high speed. I have another example which can be a little bit more easy to understand. You can see here we have practiced two cases. Using a high speed handpiece. You can see the amount of aerosols hitting back from the handpiece. And now we use the red ring handpiece. There's no splashes on the sheet. Okay. So this is something about NLZ, that means the electric micromotor. There are some other features of this. You can upgrade your air system to electric system. That means you are using a regular high-speed handpiece, you're using a coupling type, bearing type, or an air motor that can be converted into electric by using this NLZ and a red ring handpiece. We have two models available. One is called NLX Nano and one is NLZ. The difference is NLX Nano, you can use a speed increasing handpiece, and the normal 1:1 handpiece. Using a speed increasing, that is using a red ring handpiece, you can do the operations as a normal aerator handpiece, whichever normal aerator handpiece like crown bridge preparation, your cavity cutting, and all those things can be done with the red ring. And with the blue ring, you can do the polishing, finishing, and trimming. Whereas in NLZ, same features you can do here. In addition to that, you can also do endodontics with this. That is something new which you have. I'll explain how. 5 major advantages are there using a red ring handpiece or using this electric micromotor. It has a higher torque compared to your normal high-speed aerator handpiece. It has a constant speed. Constant speed in the sense, generally when you use an aerator handpiece, when you press the burr on the patient's tooth, the speed reduces. Although it runs at 4 lakhs RPM, it will come down. But here in this handpiece, whatever load you give, the speed will remain constant because the power is generated by the electric supply, not by the compressor air. Reduced noise level. The noise level is comparatively very less as compared to your aerator handpiece. Durability, the life is more because it's a mechanical handpiece. The load will be equally distributed with the complete mechanical handpiece, that is the cartridge, the drive shaft, and the dog clutch. Unlike your aerator handpiece, it's only the cartridge which takes the load. And lastly, the cutting efficiency. The smoothness or the the power with which it does the cutting is much more efficient as compared to your aerator handpiece. Later on, I'll be showing you a small video wherein you can easily differentiate between the cutting of these two handpieces. What else? As I said, generally when you use any aerator handpiece, without touching it on the patient's tooth, when you press the foot control, that handpiece runs at 4 lakhs RPM. And whenever you use a red ring handpiece, before touching it on the patient's tooth, it will run at 2 lakhs RPM. Reason? Because we are running a micromotor which will convert the speed into 5 times by using a red ring handpiece. So 40,000 into 5 times will be 200,000. That means 2 lakhs RPM for the red ring and 4 lakhs RPM for aerator. But once you touch this particular handpiece on the patient's mouth, it will go, the speed will get reduced to half. That is, the aerator handpiece will come down to 2 lakhs RPM, whereas your red ring handpiece, it will just drop a bit, but after that it will remain constant. And if you see the torque, the aerator handpiece will give you 9.2 gravitational force per centimeter, whereas a red ring handpiece will give you 400 gravitational force per centimeter. That means it is 40 times more powerful than your regular aerator handpiece. The result or the effect, because of this, you can get this particular handpiece for crown bridge removal, zirconia work. You can use it for veneer work, and also it will reduce your operation time. These are all the features of it. Mounting of this unit is very easy. Our engineers can easily fix it to you wherever you want. You can put it on top of the tray or on the bottom of it comes with the console. The console will be fitted inside the unit, whereas the display, it's very small, just like your X-ray viewer. You can fix it wherever you need. There are different options which can be done by the engineer up to your requirement. As I said, this unit has an additional feature of Endo. So that means by having this unit, you don't need to purchase any endo motors. That means it has an inbuilt endodontic feature implemented in it. So you don't need to go for any endo handpiece, any endo micromotor. And you also have the facility of reciprocating movement. That means this unit has a reciprocating feature, wherein you can easily work with the Wave 1 gold files promoted by Dentsply. 2 operations are available. The first one, as you can see, you just select the mode. It will go to Endo, and you have the feature of increasing and decreasing the speed, which can be easily done. And also you can adjust the torque also. You also have the feature of auto reverse, same like your any endodontic micromotor. So the first one which you're seeing is the 360-degree rotation. Now the second one which you are watching now, it is the reciprocating action. You just need to press the mode button once, it will go to Endo, press it again, it will go to reciprocating. And now you can see it gives you a reciprocating action. The reciprocating action will be 150 degrees forward and 30 degrees backward, same as your Wave 1 goal. Okay. So this feature is there in this. As I said, it also has the inbuilt auto reverse function. You have the feature of auto reverse auto start, you have the feature of auto reverse stop, and also you have the feature of no auto reverse. No auto reverse in the sense you can use it for polishing also. So that means this particular micromotor enables you for 3 operations. 1, to use a red ring handpiece, wherein it can take the role of a high-speed handpiece with much high cutting power. 2, you can use it for endo. And remember, for endo, you can use a normal contra-angle handpiece. You don't need to purchase any specialized endo handpiece for this. The normal contra-angle handpiece which you're using in your clinic, that can be used for endo. So that means as soon as you select the mode, automatically it will go to endo mode, and a normal contra-angle handpiece, just by connecting any file, you can work it for endodontic operations. And third, it has a reciprocating feature. But if you need to get this reciprocating action, we recommend you to purchase a speed decreasing, that means a reduction handpiece from NSK, that is 6:1 speed reduction handpiece, which will enable you to give you the proper reciprocating action. Otherwise, if you use a normal contra-angle handpiece, the speed, the reciprocating movement will be too high and it may damage your canal. Okay, so that is something with regarding this. And if you need to see it's very easy. Press the mode button once, it will go to endo, press it again, it will go to reciprocating, press it again, it will come back to general. So these are all the functions which we have. This is the handpiece which I was talking about, the 6:1 speed reduction. So that is the new style of converting your air system to micromotor upgrade system. So in addition to these features, as I told you, the utmost thing, it has a non-retraction valve, which will also prevent the reverse flow of fluids into this handpiece. And lastly, I'll just play you a small video explaining about this particular micromotor, which has the function, okay, this particular micromotor will give you a function of cutting your tooth much more effectively. In this video, you can easily justify the statement, and you can see how it works. This is the difference. So that was about this NSK's electric micromotor system, which is called as NLZE. Okay. So as I said, it has very good features of very high cutting power, and also it has inbuilt endodontic micromotor, can be used with the red ring, blue ring, and also it has a reciprocating action. Now, once you purchase this, there is also some basic maintenance which you need to do. I hope all of you are aware of this. Any contra-angle handpiece, it needs to be lubricated regularly and always with the nozzle. So each and every contra-angle handpiece supplied by NSK comes with the lubricant nozzle. Please make sure that you use this nozzle for lubrication. Ensure you cover the head of the handpiece with the tissue paper so that the oil which you spray comes out of the handpiece, falls into the tissue paper. In case if you see some blackish particles, repeat this procedure until you get the clean oil coming out. Have a practice of lubricating at least 2 times a day. If you lubricate after every operation, well and good. That's very good practice. But in case if you do not have time or some other reasons, no issues. At least 2 times a day, you have to lubricate the handpiece, and every time before autoclaving. Okay. So this is all the basic information about this lubrication. And lastly, where can you purchase, or where can you get, or where can you get the quotation, or where can you get your handpieces, NSK products serviced or bought? It's 2 distributors we have in the entire of India. Confident Dental Equipments Limited, all of you must be aware of this company, based in Bangalore. They have the branches throughout India. All the products are available with Confident Dental Equipments. Also, we have Unicorn Denmark, which is based in Delhi. They also have their branches throughout India. Most of our products are also available with Unicorn Denmark. You can contact either of them. You can be rest assured that you will be getting original NSK products from them with the sales as well as after sales services. Okay. So that was all I had from my side. So now I'm open to take any questions. If anybody has any questions regarding this presentation, you're free to ask me now.
Thank you, Mr. Sharath, for the lovely session. Before we move on to the question and answer session, there is this one question that I received from a lot of the attendees. You know, they're asking the video clipping, if you don't mind, the mechanism of non-retraction valve system, and also the last video that you just showed. You know? So if you could just play these 2 videos.
Okay, fine. In case if they're interested in this non-retraction valve, I would like to play another video which explains only about that. That would be more clear for them to understand.
Beautiful. We could do that as well. So we'll start off with the new video.
Thank you. Yes, I'll just start off with the new video. Yes, thanks. Okay, so this video will explain you the clean head system and the non-retraction valve in a detailed fashion. I just didn't play it earlier so that I didn't want the time to get consumed, but now since we have time, we can go through this.
Of course, now there is a demand for the video.
Yeah, okay.
Infection has become a growing concern among the medical profession. Sterilization and disinfection of instruments and the use of single-use products are typical examples of measures for infection control. But in the dental profession, Do you really think that sterilization of your instruments is effective enough to prevent cross-infection to your patients, to your staff, and to yourself? Dental handpieces used in a patient's mouth tend to draw saliva, blood, tooth fragments, and metal chips from the patient's mouth into the handpieces. Sprayed water tends to be drawn back into the water line when the handpiece is stopped. A suction force is generated in the head when the air turbine handpiece is stopped. Gear-driven Contra angles and handpieces also generate a suction force and draw foreign matters into the heads. Chances are that infectious virus may be drawn with these foreign matters into the headpiece. Those that were drawn into the water line may come back into the next patient's mouth. Those that penetrated into the air turbine of the handpiece are discharged at the back end of the handpiece into the atmosphere or into the dental units with the exhaust air. These foreign matters are floating into your dental office, and all of you are exposed to them. The foreign matters that remain in the handpiece just accumulate in it and are baked after repeated autoclaving. They may cause troubles or shorten the instrument life. These problems were thought to have been inherited in the dental handpieces. Nakanishi Dental tackled these problems and found a solution, both in the airline and the water line. The non-retraction valve prevents water drawback. And the clean head mechanism prevents back suction of foreign matters into the head. Nakanishi went further. The handpiece outer design was improved to have an easy to clean and yet easy to hold grip design. Nakanishi Dental has patents on these features. Dr. Carlson, professor of oral microbiology at the University of Umeå, Sweden, tested Nakanishi's handpieces with the clean head system and proved that no microorganism could penetrate into the handpiece coupling. In the spring of 1993 in France, the clean head was awarded prize for applied research in dental art at the 1993 CITAD convention. Nakanishi's clean head handpieces are being adopted by several government dental clinics as well as dentists throughout the world. Let's look at the non-retraction valve mechanism. Dental units used in most countries have a water retraction system. It is designed to prevent dripping of water at the head when the handpiece is stopped. This system draws back not only water, but also debris, virus, and other foreign matters into the water pipe. If they are retracted into the handpiece hose, the contaminated water flows into your next patient's mouth, even if the handpiece was autoclaved. Contaminants and infectants are thus transmitted to the next patient if water retraction is not prevented. In addition, they often cause clogging of the water passage. They may also cause deterioration of the pipe and hose. Growth of microorganism was cited at times. The test you are now seeing is conducted without the non-retraction valve. You can see clearly, and retracted water, colored in red, is drawn back beyond the handpiece, into the hose. Now look at the test with the non-retraction valve. The valve allows the water to pass in one way only. When pressure is applied in the reverse direction, the valve closes to shut the water from being retracted. The valve keeps the foreign matters out and prevents water from dripping.
Yeah, so that was the concept about this non-retraction valve. Yeah.
Thank you so much. Dear participants, I hope with this video, most of your doubts are cleared. Still, if you wish to see the videos that were played previously during the presentation, please feel free to add them in the Q&A section. In the next 2 minutes, we would be starting with the question and answer session. I request you to kindly note down your questions. I request you,
In the meantime, shall I play the second video which someone had asked for?
No worries, so you can do that. Thank you so much.
Okay. Okay. That's about the NLZ thing.
Yeah.
Okay. So after this video, we can have the Q&A session then.
All right.
Yeah. Yeah.
Thank you so much, Mr. Sharath. I now request you to kindly stop your screen share.
Okay. Yeah, sure. Done.
Thank you. Friends, very quickly, I'd like to tell you about the next webinar that we will be keeping. We've been having a series of webinars on various topics and various aspects in dentistry, like the one that we had today. Very quickly, we'll be putting on the poster. Yeah. So the next webinar will be taking place tomorrow, 21st April. It will be at 5:30 p.m. IST. It's on a very hot topic, the ceramic war. And the speaker, again, is a very well-known speaker, a name synonymous in the Indian prosthodontics family. Her name is Dr. Saloni Mistry. So if you're interested, you can register yourselves for this webinar, which will be taking place tomorrow. The link would be made available soon, shortly after the Q&A session. If you're interested, please feel free to get in touch with us. You can register as well. Thank you. And now we move on to the question and answer section. Thank you so much, Siddiq.
Thank you.
Doctor can share Chatti can share the screen.
Yeah, okay. Yeah, that's all. I think that was all I had from my session. So I can just play this. Yeah. Anybody has any questions?
Yeah, can we start with the question answer session?
Yeah, I'm here. I'm ready.
Perfect, perfect. Yeah, moving on with the first question, we have a question from Mr. Jaswant Reddy, who's asking, will this handpiece emit aerosols?
Which one? The handpieces which I explained. Yeah, of course, all the handpieces will emit aerosols, but the only thing is the concept which we are explaining is about the non-retraction valve as well as the clean head system. Okay, so when it talking about aerosols, all the high-speed handpieces it will generate aerosol, but the red ring handpiece it will generate comparatively less aerosols.
Thank you.
Yeah.
Moving on with the next question, we have a question from Dr. Avjeet, who's asking, how can we fix the file into this rotary?
It's a normal, what to say, like you can use a normal contra angle handpiece, and it's a handpiece which can incorporate your latch type of bursts or files. So you can simply plug in the file into this handpiece and it will start working. That's it.
Thank
Especially
you.
when you're working with NLZ. Yeah.
Thank you. Moving on with the next question, we have a question from Dr. Raman Angra, who's
Mhm.
asking, can you please explain about the water connection in the electric motor? Kindly explain it in detail.
Okay, this particular NLZ motor, which I was talking about, it comes as a display as well as a console unit. Okay, for the console unit, you have to connect the tubing of your dental chair, the same tubing which you use for your high-speed handpiece, the same tubing which you use for your aerotor. That tubing has to be connected to this unit. We have a connection wherein directly this tubing will get connected into it. So the water from your dental chair, it will enter this unit, pass through the motor, and then come to the handpiece. So that means the water comes through your dental chair itself. That will be done by the engineer once he comes for installation.
I hope, Mr. Raman Angra, your question was answered. Moving on with the next question, we have a question from Santosh Deshmukh.
Mhm.
As you said, in Optic HP inbuilt anti-retraction valve, so why there is a need of QD coupling?
Okay, this QD coupling was mainly for the non-optic handpiece, not for the optic handpieces. Yes, for the optic handpiece, he's right. It comes with the coupling which has a non-retraction valve. So whatever I explained, this QD type is mainly and only for non-optic handpieces, the ones which does not have light provision.
Thank you. Moving on with the next question, we have a question from Dr. Oais, who's asking, any specific guidelines for use, any do's and don'ts?
For do's and don'ts for?
No, that was the question. I believe he would be asking about the anti-retraction handpiece.
Yeah, I guess no, there is no maintenance which he needs or he or she needs to take care about this anti-retraction valve. But do's and don'ts maybe for the handpieces. Yes, we recommend you to not to work with very high air pressure. We recommend you to lubricate your handpieces regularly. We do not recommend you to apply load during operation. Use a feather touch method because these handpieces are the handpieces which runs by speed. So you have to cut by speed and not with force. And lastly, always have a habit to lubricate very frequently, at least 2 times a day. That's it.
Thank you. The next question, sir, I believe is a very common question. We've received questions from YouTube Live, the same questions on Facebook Live, as well as definitely on the Zoom Live. The question is, can you please mention the price of the handpiece? That's one. Second
Okay.
is, can you also mention the cost of the NLZ-E?
Okay.
Yeah,
So
everyone wants to know the exact price. Probably you could just reveal price.
okay, the screen which is there right now, those are the people who will be able to give the exact price for this because we have the authorized distributors, that is Confident Dental Equipment Limited and Unicorn Denmark. So NSK is not selling any products directly in India. So it would be good if they can contact any of the representatives, whoever they feel convenient with. I can give a rough idea. The NLZ unit with the red ring handpiece, because we are selling it as a package with the red ring handpiece, because the unit has no meaning without the red ring handpiece. It will be somewhere in the range of 1,25,000, around 1,25,000. And if they need the red ring as well as the speed reduction handpiece for Endo, it will cost somewhere about 140. So, but to be precise, I would recommend them to contact either Confident or Unicorn. Yeah.
Thank you. We have another question. I hope you don't mind answering it. Since we attend in the webinar, is there a discount on the handpieces?
Again, the answer is with Confident and Unicorn. In case if they wish to give any discount or if they, it's up to them. So unfortunately, I cannot answer that.
All right.
So I cannot assure any of such things.
Okay. Maybe the participants are looking out for a coupon code. Special
Sorry,
coupon
they
code.
don't
Yeah.
have such
Yeah.
proceeds.
Jokes aside, moving on with the next question, we have a question from Dr. Raman. He's asking, can red ring electric motor handpiece be attached to NSK Surgical Pro Physio Dispenser? And can normal micromotor contra angle handpiece be attached and worked on NSK's Surgic Pro Physio?
Okay, very good question. For the first one, can the red ring handpiece work on the Surgic Pro? Unfortunately, this red ring, the one which I promoted here, that will not work on the Surgic Pro. But there is another red ring handpiece from NSK, which is an external irrigation one. Because the Surgic Pro comes with external irrigation, that handpiece will fit into the Surgic Pro. So they can get in touch with either Confident and Unicorn. They can guide them on exact price and other things. If they want, they can note down. It's the model name is XSG93L. I repeat, XSG93L is a handpiece, a red ring handpiece which can fit into Surgic Pro. And second question, yes, any normal contra angle handpiece can fit into Surgic micromotor. You can use, not an issue.
Thank you. Moving on with the next question. Can you please explain the difference between Nano and NSZ electric motor?
Okay, very good question. Again, NLX Nano is the electric micromotor which comes with the feature of using red ring as well as blue ring handpiece. That means they can use a speed increasing handpiece and a normal contra angle handpiece. Whereas NLZE comes with the same features. In addition to that, it has a feature of endodontic micromotor in it. It has an inbuilt endomotor in it.
Thank you.
Yeah.
The next question is, do you have a distributor in Germany? If yes, can you please share the details?
Yes, we do have a distributor in Germany. It's we have an NSK office itself in Germany.
Okay.
Yeah, maybe if they log into our website, NSK website, which is www.nsk-dental.com, we have the complete addresses of all our branches, so they can get it there itself.
So can you please repeat the name of the website?
Okay, it's www.nsk-dental.com or www.nsk-inc.com. Both of them, they can log in.
Thank you. Moving on with the next question. Can red ring or blue ring handpiece be used without water to decrease aerosol? What's the recommendation for this?
Okay, blue ring handpiece can be used without water, no issues, because it's a low ring, it's a low speed handpiece. But red ring handpiece, we do not recommend to use without water. It has to be used with water. Otherwise, the handpiece will get heated up, and also that it may burn the patient's tooth also. But they can be rest assured the amount of aerosol which will be generated by a red ring handpiece, which will be comparatively much lesser as compared to the aerator, regular aerator handpieces which they're using, as seen in the video.
Thank you. Moving on with the next question, we have a question from Dr. Julie Harsoda, who's asking, the Pana Airfix Sub 2 handpiece, does it have QD system or not?
Yes, it has. The Pana Airfix has a QD system. Yes.
Moving on with the next question, a question from Dr. Jaswant Reddy. Can an air rotor be used again if in case after the settings of dental chair change to NLZ electric handpieces?
Yes, it can be used, but not on the same tubing, but on a different connection. Because once you connect the tubing to the NLZ, that has to be dedicated for that itself. And in case if the doctor wants to use the same tubing, then he has to again dismantle the tubing and then he can use. But generally we recommend to use a different tubing. Yeah.
Thank you. Moving on with the next question, we have a question from Dr. Kasina, who's asking, does the NLZE has apex locator function?
No, NLZE does not have the apex locator function. It only has the inbuilt endomotor. That's it.
Thank you. Moving on with the next question, we have a question from Dr. Shezian. Can we use the same technique for surgical impaction? And which model handpiece do you recommend? Should I need to purchase a whole new set?
Okay, for surgical impaction, if the doctor is already using Physio dispenser in the clinic, I would recommend the doctor to go for microsurgery handpieces. We have handpieces with which you can do surgical impaction. We have like 20-degree angled handpieces. We have the straight handpieces. I recommend the doctor to contact Confident or Unicorn. They will be able to provide all the details required in this matter.
Thank you. Moving on to the next question. Do we also require non-retractive valves in our scalers?
No, not needed. The reason behind that is in the scaler, what happens is there will be no reverse flow taking place because scaler works independent of your air pressure. Okay, it's just only the water which we take from the dental chair. There is no air pressure involved, so the scaler does not need the non-retraction valve.
Okay, thank you. Moving on to the next question. Since there are many companies promoting disposable handpieces during the COVID-19 pandemic time, could you please clarify which is better for clinical use and why?
Okay, depends on what is the mechanism or what is the quality of the disposable handpiece which the doctor is talking about. Yes, I do understand it's much easier for the doctor to use disposable handpieces, but talking about the high-speed handpieces, it needs a lot of mechanism and lot of technology to be involved, which I personally feel that it cannot be implemented as easily in any disposable handpieces which is available at such low cost in the market. So it's always better to use a non-disposable handpiece with proper maintenance. They can have a longer life as well as a much safer usage. That's what I feel.
Thank you. Moving on with the next question, we have a question from Dr. Singh. Please explain about how you adjust the water flow.
Water flow generally has to be adjusted by the dental chair itself. Depends on which dental chair you're using. A dental chair will have a flow control valve, okay, with which you can control the water. From an SK, in case if the doctor is having an optic type of handpiece, we have an optic type of coupling, which has a water control adjuster also. If the doctor is very much concerned on this, he can go for that. But if the doctor is using about the non-optic handpiece, the water control can be done by the dental chair itself.
Thank you. Moving on with the next question. What is the lifespan of the handpiece that you mentioned in your presentation?
Very good question. It all depends on how the handpiece is maintained. If the handpiece is properly maintained by following the basic criteria, that is the maintaining the proper air pressure, lubricating the handpiece properly, doing the proper sterilization, and also not applying load and using a good quality burst. If all these features are taken care very well, then the average life of any NSK handpiece will be not less than 2 years. That means minimum 2 years is the lifespan of any NSK handpiece.
Thank you. So friends, minimum 2 years is the lifespan. Moving on to the next question. Is there any special kind of burr do you suggest to use in the non-retractive head?
Special type of, sorry, can you repeat the question?
Burr. Okay, I'll repeat the question. Is there any special kind of burr that you suggest to use in the non-retractive head?
No. There is no specific. Only thing is the burrs which you use for any type of dental handpieces. We recommend the doctors to use a good quality burr, like such as ISO certified burrs. Yeah.
Okay, thank you. Moving on with the next question. What are the types of handpieces NSK offers to conduct endo and implant surgeries?
We have different types of handpieces for endo. We have different types of handpieces for implants also. We have a range of handpieces which can be connected to the normal micromotor. We have the range of endo handpieces. We have endo motors also from NSK, Endomate DT, TC2, and Endomate AT. And we have a range of handpieces for surgical micromotors also, like for implants also. Again, Confident and Unicorn can provide the complete list of these handpieces, and the doctor can.
Thank you. Moving on to the next question, we have a question from Dr. Kasina who's saying, can the NLZ be easily installed by a dentist without the need of a technician? Because remote areas, it's very difficult to find technicians, especially owing to the fact that it's, we are in the pandemic era.
I understand. If it's the underhanging dental chair in the sense wherein the tubings are underhanging, not overhanging, yes, the doctor can do it by himself. If it's overhanging, it may be difficult. I'll not say it may be, it will be difficult. So it would be better to call for an technician. So, but currently the NLZ model is available only for underhanging. Yes. So the doctor can install by himself by following the installation manual. Yes.
Thank you. Moving on to the next question. The micromotor appliance, as you mentioned, can be used for surgical impaction. What is the recommended RPM?
For which one? Can you repeat? Sorry.
I'll repeat. The micromotor appliance, as you mentioned, can be used for surgical impaction. What is the recommended RPM? That was the question.
Okay. If they're using a handpiece from NSK for impaction, any handpiece which you use with NLZ, the maximum speed you can go is 200,000 RPM, that is 2 lakhs RPM. And if the doctor is using a handpiece for impaction in your Surgic Pro or any other implant motor, the maximum speed which will be available will be 1,20,000 RPM. So the doctor can go up to that level, up to as per their requirement.
Thank you. Moving on with the next question, we have a question from Dr. Ayushi who's asking, in the NLZE, is it compulsory to use NSK contra-angle handpiece, or we can use any other contra-angle handpiece as well?
In NLZE, you can use any contra-angle handpiece for endodontic usage, not only NSK, any other company also, but only for reciprocating movements, we recommend them to use only NSK handpiece.
Thank you. For the next two questions, I think maybe I do have an answer. This was a question asked by Dr. Monish Kohli, who's asking, can we have a recording of this session? Yes, sir, you definitely can see the recording. It will be live on Facebook. It is also saved on Facebook. At the end of the session, you can simply log in on your Facebook account and type DentistChannel.Online. The same goes to Dr. Praduman Malik, who says he missed a short session. Okay. You can also find the complete session. Thank you. Moving on with the next question, we have a question from Dr. Indrajit. If NLZ doesn't have a built-in apex locator, how come it has auto reverse and auto stop feature?
Okay. Actually, this auto reverse and auto stop feature is basically an endodontic micromotor feature, not the apex locator feature. Apex locator is mainly used for measuring the depth of the canal. Yes, some companies come with the feature of endomotor with apex locator built in, but this particular feature of auto reverse and auto stop, it happens mainly with the motor, not with the apex locator. So as a result, we have NLZ, which has the feature of auto reverse without having the apex locator.
Thank you. Moving on with the next question, we have a question from Dr. Sunil Kumar. Can normal straight handpiece be used for endo purpose without a reciprocation in NLZE?
No, we do not recommend a normal straight handpiece to be used for reciprocating action. For reciprocating, we always recommend to use a contra-angle handpiece. As a result of which, no, the answer would be no.
Okay, thank you. Just give me a minute.
Yeah.
In the meantime, I'll take this next set of questions. Okay, we have a question from Dr. Ferreira. Is the non-retraction valve implemented in the air motors as well? FX205, M205, X205L, and not just in the couplings and the electric motor?
Okay, the non-retraction valve is implemented in M205. Any NSK micromotor with the internal spray facility, yes, there is a non-retraction valve. But any micromotor without the internal spray facility, we do not have this non-retraction valve.
Thank you. Moving on to the next question. A question from Dr. Khalid Bakur. Since we have QD type Pana Air FX, why is it not coming with light?
Okay, the QD type actually it's a coupling which has the facility of non-retraction valve and the the swivel-free mechanism without the light. For light, you have to go for the different type of coupling, that is the PTL coupling which we have. QD type is mainly designed for non-optic handpieces. That's the reason we don't have light implemented in it.
Thank you. Sir, I'd like you to answer to the question once again. What is the price as a general question that I'm receiving once again.
Price of?
They're asking the price in general. Maybe you can just mention the fact about the distributors.
Okay, yeah. Any queries or prices for any of NSK products, it's easily available, or you can easily contact two of our distributors, or I mean any of our distributors. We have two major distributors in India. One is Confident Dental Equipments, that is Confident Sales India, located in Bangalore, and they have branches throughout India. And we have Unicorn Denmark, located in Delhi. They also have branches throughout India. So the screen itself gives you the details of the email, website, as well as their phone numbers. You can get in touch with any of them. They will provide you with the prices.
Thank you. Moving on with the next question, we have a question from Dr. Khataukar. Is QD system available for both 2-hole and 4-hole connections?
Yes, it is available for both 2-hole and 4-hole connections. In my slide, I had shown you the two pictures of the couplings. One was for 2-hole and one was for 4-hole.
Thank you. Next question from Dr. Anita Kumari. I guess all these coupling handpieces could be autoclaved?
All the coupling, yes, all the coupling handpieces can be autoclaved, but the couplings should not be autoclaved. That's a very important thing. We recommend doctors not to autoclave the coupling. Only the handpieces has to be autoclaved, and yes, all handpieces are autoclavable.
Thank you. Next question from Dr. Rutu Patel. Are the handpieces available in mini sizes?
Are the handpieces available in? Yeah, two sizes. The handpieces are available in two head sizes. One is miniature head and one is standard head. Miniature head, the head size is slightly smaller, which gives you a better accessibility for your third molars. And standard head is the bigger head for which you can do the regular operations.
Thank you. Moving on with the next question. A question from Dr. Avjeet. How can we fix the rotating file into this?
Into what? Into the regular handpiece?
I believe it would be the handpiece. It's
And
not
then,
mentioned.
okay, yeah. The file, it's a file generally comes with the latch type. All latch type files can easily be connected into the what to say, like the 6:1 reduction handpiece. So it's the handpiece is designed such that it can incorporate any latch type files. So it's as simple as it is. It's just like fixing a bird. Very simple.
Thank you. Moving on with the next question, a question from Dr. Murali. What is the life contraction valve or ring, and is it nitrile?
What is the life of the
Contraction valve or ring, and is it nitrile?
Okay, yeah. Actually, the O-ring, it's specialized. We have made it as how can I say? It's a special type of fabric. But yes, it's the lifetime is upon regular autoclaving, it may reduce its life. But with the unit, we always provide one set of O-rings as a spare, and these O-rings are available separately as a spare part also, available at very minimal cost.
Thank you. Moving on with the next question. Do I have your permission to ask you more questions, Mr. Sharat?
Yes. Yeah, I'm free, provided you're you're okay.
No, definitely. We'll have to. Thank you. Moving on with the next question from Dr. Kasina. What is the warranty period of NLZE and non-retraction handpieces?
1 year. All NSK handpieces except for the basic ones. Okay, now I can say 1 year. Yes, even for the previously we used to give 6 months warranty for the basic ones, but now we have increased that to 1 year. So all NSK products comes with 1 year of warranty from the date of sales. Either they purchase from Confident or they purchase from Unicorn. Doesn't matter.
Thank you. Question from Dr. Reddy. Do you have any articles that has an evidence of reduction of aerosols in the handpieces that you've shown? And if so, what is the percentage of reduction in the aerosol?
Unfortunately, we do not have any such articles right now because this aerosol thing has come into what to say, like importance during this COVID-19 period. But yes, our company is working on it. Once it's ready, it will be published or it will be advertised everywhere. Yeah, not an issue.
Thank you. Moving on with the next question. When can I expect a handpiece if I place an order today? I believe she's asking maybe since it's due to the lockdown.
Yes, I think whatever possibility or whatever earliest would be possible only after the lockdown is released. So either from Confident or Unicorn. Otherwise, regular time, yes. If the handpieces are in stock, which I believe generally they have it, maximum 3 to 4 days or maybe 1 week, depending on the place where they are. Yes, that would be the maximum time.
Thank you very much. Moving on with the next question, we have a question from Dr. Ayushi. What are the accessories we get along with NLZE?
NLZE comes with a display unit, a console unit, which is combined to each other. Then it comes with a micromotor and the tubing and an adapter. It doesn't come with any handpieces. But as I said, the package, what we have made, it includes a red ring handpiece, if they purchase from Confident or Unicorn, whoever, which will be needed for this. But otherwise, the basic thing just comes with the unit and the adapter. That's it.
Thank you. I believe with that, it was the end of the question answer session. We would still wait for the next 30 seconds. Okay. In the meanwhile, sir, I'd like to take this opportunity on behalf of team DentistChannel.Online to congratulate you on a houseful presentation. We had houseful on Zoom. We definitely had several people watching it on Facebook as well as YouTube. Apart from me, we have a lot of people, starting with Dr. Sabita, who said it was a beautiful, crystal clear explanation. Thank you so much. From Dr. Arun, who also said it was a fantastic session. And many names to take with Dr. Sunita, Dr. Meera, Dr. Korne Faria. Thank you so much. I'm sure they all liked your session. Yeah, I guess with this, we come to an end. Okay, we have another question, sir. Please don't mind me asking it. Can you please repeat model number of red ring handpiece which can be used on a Physio?
Okay, it's X-SG93L. X-SG93L. They can get in touch with Confident or Unicorn. They will be providing with the exact prices.
Okay. One more question. Why the coupling should not be sterilized?
Okay, the coupling has no direct contact into the patient's mouth. Generally, the coupling remains much behind the handpiece, so it has no direct involvement into the patient's mouth. So as a result of which, there will be no possibility of saliva or any other bacteria or other things to fall on it. But yes, they can clean it externally, but we do not recommend to autoclave it for two reasons. One, regular couplings, the one with light, it will damage the light filament. Two, the non-retraction valve, which is there in the coupling, that may get damaged if it's autoclaved. These are the reasons.
Last question from Dr. Indrajit. Red ring handpieces produce less aerosols. Does it mean it uses less water?
No, of course not, because the water comes directly from the dental unit. The same water flow which comes to your regular aerator handpiece also. So the water flow will remain the same, but only thing is less aerosol. Aerosol, the reason behind that is the involvement of air is comparatively less in a red ring handpiece as compared to your aerator handpiece. That's the reason.
Thank you once again from Dr. Jaswant Reddy. Very good presentation on the right time. I'm sure this was the right time and the best time to discuss about the anti-retraction handpiece system. Friends, with this we come to an end. As I said, you can get in touch with the authorized distributors in India. They are Confident Sales India Private Limited based in Bengaluru, and as well as Unicorn Denmark, who's based, I believe, in New Delhi. Yes, in New Delhi. You can get in touch with them. You can get in touch with Mr. Sharat Shetty. Sir, how can someone get in touch with you if just in case they wish to?
Okay, yeah, I'm available on WhatsApp as well as I'm available on my email. I'll just read it out to you. My email address is Sharath, SHA, my name, SHARATH at nskdubai.ae. I repeat, Sharath, SHARATH at nskdubai.ae. And my phone number for WhatsApp would be +97 156 577 3630. I repeat, +97 156 577 3630. So anybody can get in touch with me either of in these two forms. Yeah.
Thank you, friends. Like we've mentioned earlier, you can register for the next webinar and for the upcoming webinars on www.DentistChannel.Online. Thank you so much for participating. It was definitely a fun, interactive, and a lovely session. Definitely at the right time, we spoke about the right and the most important topic. Once again, Mr. Sharath, thank you so much for the lovely presentation.
Thank you, Ruben. Thanks to you for all the arrangements done. Thanks to Melvin. Thanks to you and your entire team, and I wish you good luck for all the remaining seminars. And thanks to all the attendants who attended this session of mine. Thank you very much.
Thank you so much. Thank you so much. Friends, just one last thing. You all deserve a certificate of participation because of the dedicated time that you've given us and for the webinar. The same would be issued to you within 3 working days. With this, I say goodbye to each and every one of you. May you all have a good day and good evening. Thank you so much.
Bye-bye. Thank you.